Dr. Aneesh. I'm a consultant physician working in Lakshmi Hospital, Alva. I've been working as a physician for the past 5 years. Okay, so let's come to the topic now. So today's topic is understanding hypertension. We all know what hypertension is. So to get a better picture of what hypertension is, I will start with what blood pressure is first. We all know that blood pressure is the pressure exerted by blood over the blood vessels, into the blood vessels. This creates pressure against the wall on the blood vessels. This is called blood pressure. Okay, so normally in healthy persons, this blood pressure vary during the day. Like it rises sometime and it falls sometimes. So when it remains higher for a prolonged period, it is called hypertension. Okay. So why? What is the cause for hypertension? There are certain risk factors for hypertension. So certain risk factors are, one is you all know, it's age. Another one is family history of hypertension, and another one is excessive salt intake, and the other one is eating unhealthy diet, and another one is stress. These are the common risk factors associated with hypertension. And what happens if hypertension is not controlled, if BP is not under control? If BP is not controlled properly, it will lead to certain complications. Like it will affect our organs like heart, blood vessels, brain, and eyes, etc. Okay. So, and what are the symptoms of hypertension? You may be aware of the symptoms of hypertension, like headache, fatigue, then nausea, vomiting, etc. These are the common symptoms. But the problem is, many of the times hypertension manifests without hypertension occurs without any warning signs. Like there will not be any symptoms. So that's why it's called a silent killer. Okay. So what is the normal BP? Normal BP is approximately between 120/80 to 130/80. And it is called hypertension when it is more than 140/90 millimeter of mercury. So how BP is measured? You may all know there is an apparatus called sphygmomanometer. We will record BP using that apparatus. And if the BP is persistently above 140/90 millimeter of mercury, it is called hypertension. So what does it mean? What is this 140? What is 90? 140, the upper range is called systolic blood pressure, which is the blood pressure which is recorded when the heart contracts, and it will exert pressure on the blood vessel wall. And the lower BP is called diastolic BP. It is the pressure exerted by heart when it relaxes, means when it is in diastole, when the heart relaxes. These are the two BPs we usually measure in our practice. And now you may all be aware that on May 17th we celebrate as World Hypertension Day. It is celebrated to highlight the importance of monitoring blood pressure and bringing global awareness to all the people all over the world with hypertension. And this year's theme is measure your blood pressure, control it, and live longer. This is the theme of this year's World Hypertension Day. And now coming to how we can control the blood pressure. So as we already discussed, there are certain risk factors. So we have to tackle that risk factors. One is you have to eat healthy diet. There is a diet called DASH. It is, we'll come to that later. And one is a healthy diet. Another one is regular exercise. And if you're a smoker, you have to quit smoking, and you have to moderate your alcohol consumption. And and you should monitor your blood pressure regularly. And another one is we already discussed that stress is one of the risk factors. Your stress management is also important. Another one is adherence to antihypertensive medications. If you are started on any antihypertensive medicines, okay. So come to move on to the one by one. First is regular exercise or physical activity. It's very important that you have to follow a healthy lifestyle. At least you should do a 30 minutes walk, aerobic exercise a day for most of the days in a week, at least for 5 days in a week. This will help to lower the blood pressure. Another one is healthy diet. Healthy diet means you have to eat adequate vegetables, fruits, and whole grains in your diet. You have to include all these in your diet. And there is a diet called DASH. That is, DASH stands for approach to stop hypertension, dietary approach to stop hypertension. So it includes the whole grains, fruits, vegetables, low fat dairy products, etc. This will help to lower the blood pressure. Another one is reduce sodium in your diet. Even a small reduction in the sodium in your diet will help to improve the blood pressure. So how can we know about the sodium in our diet? So one is you can read the food labels. If possible, choose low sodium alternatives of foods and beverages you normally consume. And eat fewer processed foods. We all know that processed food contains more sodium than natural foods. So try to eat more natural products. And another one is don't add salt in your diet. Just one level of spoon has approximately 2.3 grams of sodium. So it's better to avoid taking salt in the food. Another one is quit smoking. If you're a smoker, will definitely increase the chance of you developing high blood pressure. So stop smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. And another one is regular blood pressure monitoring. Once you are diagnosed with hypertension, you should monitor your blood pressure regularly. Even if you are not diagnosed with hypertension, you should monitor your blood pressure regularly to see to confirm that it's within normal limits. Another one is stress management. Stress management means by learning how to relax and manage your stress can improve your health, physical and emotional health, and it will also help in lowering the blood pressure. So stress management techniques include, one is exercise, another one is like listening to music, and focusing on something like calm or peaceful activities, and meditation, etc. will help. Another one is adherent to medicines. Once you are prescribed antihypertensive medication, try to adhere to the medicines every time, and do your follow-ups with your doctor regularly to keep your blood pressure under control. These are certain ways, certain measures you can take to control your blood pressure. So I wish all of you a good health.